OK, next tonight. Since 2003, the Movember movement has been raising awareness for men's health. This week, they've released a report which calls on ministers to focus on what they call the growing public men's health emergency. It found almost 2 in 5 men in the UK die prematurely, that's before the age of 75. And what's most striking is that it highlights in detail that where a man lives is strongly connected to how long he will live. And it's not good reading for Scotland. Here, the rate of premature male deaths is 26% higher than the rest of the UK. It found 5 of the 10 worst areas in all of the UK are in Glasgow. Glasgow North East has the worst rate, while its neighbour, just over in East Bartonshire, has the lowest. In a moment, we are going to hear from Rashik Saeed about his experiences of mental health. But first, to tell us more about this report, Tom Ellis from Movember is here with us. Tom, a very good evening to you and thank you so much for joining us. Tell us a bit more then about the report, the research, who you spoke to and what you found.
Yeah, so we launched a report today and I think it paints a very stark picture of men's health in the UK. So I think, as you mentioned in your intro, too many men across the UK are dying too young from largely preventable causes. And, 2 in 5 male deaths in the UK premature, it's about 133,000 lives a year gone too soon. And I think, as you mentioned, Scotland has the highest rate of premature mortality amongst men in the UK. And we polled, so it looked at sort of existing evidence, but also polled about 3,000 people across the UK about their experiences. And I think one of the really interesting things it shows is just this ripple effect that men's health has on wider society. We've all got fathers, sons, partners, brothers, mates who are affected by ill health, and it impacts all of us really strongly and has this direct impact on everybody. So I think what we're trying to do with this report is really called to note the fact that we need to act with urgency to tackle this crisis. And so Movember and 20 other partners involved in the report are asking the government to deliver a men's health plan that can prevent so many men from dying too young.
Well, tell us more about what kind of things then that you'd like to be addressed through that. What do you think the main problem is? Is there an issue with communication with men going to the doctor and asking for help?
Yes. I mean, it's a complicated picture, I think, as it shows in the report. But, there's a number of different reasons why men are dying too young. I think they're more likely to have less healthy lifestyles, engage in risky behaviours. In general, they're less likely to seek help when they need it. I think men are not always being proactive about their health. In the UK, if you're aged 40 to 75, you're eligible for an NHS health check every 5 years. The latest data shows only 62% of men actually, complete that health check. And I think another contributing factor, which again has really been showcased in the report, is that healthcare isn't always responsive to the needs of men. So when men do seek help, in our report, it showed that 63% of men reported wanting to leave the kind of healthcare practitioner they were with due to a lack of personal connection. So I think it's also really important that we're looking at the healthcare system and how it's responding to gender and responding to the needs of men. So I think what we're kind of asking for when we ask for this sort of strategy, we're looking at 3 areas. So one is strengthening health literacy among men. So initiatives reaching men and giving them the right knowledge and skills so they can better understand their health. We want to transform the health system and workforce by making it gender responsive, as I mentioned, so fewer men are dropping out when they do go and seek help. And we also want to see an investment in research into men's health specifically.
OK, and in terms of policy, Movember has been speaking to Neil Gray, the Scottish Health Secretary, about policy change around this. What do you think the Scottish Government should be doing immediately to, quickly to try to address these figures?
Yeah, we've been speaking to Neil Gray. He's actually visited one of our programmes as well, Changing Rooms in Scotland, which we run with Scottish Action for Mental Health. So there's really positive noises coming out. I think we also shared the report this morning with about 200 policymakers, and Sir Gregor Smith, the Scottish Chief Medical Officer, was one of the first people to respond. So I think we're hopeful of a great collaboration to create change. But what we'd love to see is an announcement of a plan for men's health, a national plan for men's health.
OK, well, thank you so much for your time tonight. Many thanks. We're really grateful to you. And joining us now, just to talk more about his experience, is Rashik Saeed. Good evening to you.
Good evening.
So you have been on a mission really to raise awareness about men's mental health, haven't you? If you wouldn't mind, just talk us a bit through your journey and what your experience has been.
Well, I think, like many other people, I've been affected by sort of just struggles with mental health since I was a teenager, really. And I found in the South Asian community, it really wasn't spoken about, particularly sort of 10, 15 years ago. And I remember the first time I went to uni and I came across Movember, and suddenly I had like a portal to sort of express, my struggles. But not only that, they also provide a platform for me, people like me, to share these experiences in communities where men are welcome. And it should be said, it's not just men. And these things that that we feel, it affects everyone. So really having that opportunity to create events and engage wider communities within the uni and actually out with the uni, even just within sort of my my wider family circles and within the South Asian community in Glasgow with friends, family, things like that. And yeah, I mean, it's like over a decade later now, and it's completely different. I know there's still a lot to do, as that report today clearly shows. But yeah, I'm grateful to be a part of that process, really.
And this report really drew on the inequalities, the regional inequalities, didn't it? We just looked at those numbers for Glasgow being so bad. Why do you think that is?
I think there's definitely a West of Scotland lifestyle, whether it be the socioeconomic issues that that are faced with through the 1900s and the 1950s, and that is expressed into what we see today. Like I would say, I think the communication of that is a lot better now. 10, 15 years ago, Glasgow was a very different place. But yeah, there are other charities and alongside Movember, that are localized that really help with that. So Sam H is one that Tom mentioned. Another great charity is Tiny Changes, and I think altogether they're doing a lot. But frankly, it needs to be policy driven. And yeah, during my day job, I actually work at the West of Scotland Innovation Hub, which is a part of the NHS, and we are policy driven from Scottish Government to come up with innovative solutions for things like, for me, mental health. I specialise in
Give
that.
us a quick sense then of what you mean by policy. What kind of things would help?
Well, I think looking at healthcare more holistically, not just looking at GP surgeries and hospitals, but also looking at how do we keep people out of primary and secondary care healthcare. So if you can address lifestyle changes, if you can address a lot of the cultural issues that come with, a lot of areas in Glasgow, the areas that are highlighted by this report are in the lowest percentile for socioeconomic conditions. So in those areas, you have to address those issues. You can't just rely purely on healthcare.
Yeah. What would you say? What would your best advice be to somebody who was in the position you were in 10 years ago?
I think that position has changed. I think the conversation around mental health now is very different, but it still needs to be a very serious conversation. I think, you can get in a group and you can laugh about it, but that's still talking about it. And we are at the point now where I believe talking about it is no longer enough. So whether it be government intervention or just more serious cultural conversation and action around mental health, I think that's what's necessary.
And as you say, there are those organisations out there to help people, the BBC Action Line among them. But listen, thank you so much indeed for coming in tonight, Rashik. Really nice to see you. Thank you.